Welcome to a deep dive. Today we're exploring a truly exciting space. Natural medicine, not just folk remedies, but the rigorous research coming out between May 2020 and May 2025 that shows findings delivering what our sources call exceptional results.
That's right. We're sifting through these science, high-quality human studies like clinical trials and systematic reviews, looking for those, standout moments. And exceptional here. Well, it's not just hitting a statistical threshold.
No, it's about addressing real unmet needs. Maybe offering a completely novel approach, or perhaps giving you a clear advantage over existing treatments, things like, say, better safety, fewer side effects, or just being easier to tolerate.
Exactly. It's where traditional wisdom sort of meets cutting-edge research, unlocking some really remarkable possibilities for your health.
Okay, let's unpack this.
Let's dive straight into an area where new solutions are, frankly, desperately needed, tackling infections. As you know, antimicrobial resistance is a huge global challenge.
Absolutely. We really need new tools.
And sitting right at the top of our list of fungal infections is Ibrexafungerp.
Right, Ibrexafungerp. This is a big deal, isn't it? It's described as a first-in-class antifungal.
It really is. And what's fascinating is its origin, it's derived from a natural product in fumifungin, which comes from a particular fungus, Hormonum carpetanum.
So nature providing the blueprint, essentially. How does this one work compared to, say, the older treatments?
Well, it targets something different. Many older antifungals, like the azoles, they work on the fungal cell membrane. Ibrexafungerp inhibits a key enzyme, 1,3-G-glucan synthase, which is essential for building the fungal cell wall that rigid outer layer fungi need.
Ah, so it's attacking the structure itself.
Yeah.
Like disrupting the bricklaying for their protective fortress.
Exactly, a totally different mechanism. And the clinical trials for a very common fungal issue, vulvovaginal candidiasis or
VVC infections, yeah. Those results looked pretty strong.
very strong. In the VANISH phase 3 trials for acute VVC, Ibrexafungerp didn't just improve symptoms, it significantly increased the rate of clinical cure, meaning symptoms resolved, and mycological eradication, so actually clearing the fungus compared to placebo.
Much higher cure rates then.
Oh, yeah. We're talking about, doubling the cure rate in one study and significantly improving sustained symptom resolution weeks later, too.
And for people who suffer from recurrent infections, that can be really tough.
Well, the CANDLE trial looked at that. It showed that monthly dosing for 6 months helped a significant majority, around 65%, achieve clinical success. That means they cleared the infection and didn't have it come back during that period, compared to about 53% with placebo.
Which led to FDA approval for both acute and recurrent VVC, right? First in 2021, then 2022.
Correct.
So why is this exceptional according to our sources?
Because it's the first new oral non-azole antifungal approved for VVC in literally decades. Its novel mechanism makes it effective even against strains resistant to older drugs. And crucially, it offers an option when azoles maybe can't be used, like during pregnancy, for instance. It directly addresses an unmet need for alternative effective treatment.
That's huge.
Yeah.
A real new tool in the toolbox. Okay, let's pivot a bit to oral health specifically. Gum disease like gingivitis and periodontitis, which are bacterial problems.
Right. And recent systematic reviews, including one updated searches in late 2024, are highlighting that some herbal mouthwashes are performing, well, comparably to the conventional standard, which is often chlorhexidine or CHX.
Comparable effectiveness, but from natural sources. What kind of ingredients are we talking about here?
Things like pomegranate extract, punica granatum, green tea, Camellia sinensis, and also polyherbal blends, some including ginger, rosemary, and calendula.
Interesting. And studies are showing they can actually reduce the signs of gum disease,
Right.
plaque inflammation.
Exactly. A 2021 randomized controlled trial on 5% pomegranate extract, for instance, showed significant reductions in plaque index and gingival index, even lowering a key inflammatory marker, IL-1 beta, compared to placebo over 4 weeks, and importantly, with no reported side effects. And older studies cited in these recent reviews found other blends, like one with aloe vera and green tea, or another with ginger, rosemary, and calendula, performed comparably to CHX in reducing plaque and inflammation scores.
So if they're just comparable to CHX, why call this exceptional? Isn't CHX the gold standard?
It often is for efficacy, yes, but the exceptional part here is often the safety and tolerability profile. CHX is effective, but, many people find it causes tooth staining, changes their sense of taste, or irritates the lining of their mouth.
Right, those are common complaints.
Especially with long-term use, which you often need for chronic conditions like gum disease. So having natural options that are just as good at fighting plaque and inflammation but have fewer unpleasant side effects is a really significant advantage. It means you're more likely to actually use them consistently.
That makes perfect sense. Better tolerability for a chronic issue is a big win. How do they think these herbal rinses work? Is it one compound or?
It's likely a combination effect. These plants contain various natural compounds, things like polyphenols, flavonoids that have antimicrobial, anti-inflammatory, and antioxidant properties. They seem to be hitting the problem from multiple angles at once, synergistically.
Right.
Though the reviews do point out, quite rightly, that we need more large-scale, longer-term studies to really solidify these findings broadly.
Fair enough. More research always needed. Now let's talk about tea tree oil, or TTO. It feels like TTO is everywhere as a general antiseptic, often marketed for fungal issues, like athlete's foot or nail fungus.
It does have a long history of topical use, absolutely. And lab studies, in vitro work, including one from January 2025, show it kills dermatophytes, the fungi that cause those infections.
Okay, so the lab data looks promising. It kills the fungus in a dish.
Yeah.
What about recent human trials showing exceptional fungal relief, like clearing up stubborn infections?
This is where the sources in our time frame, May 2020 to May 2025, are quite specific. While TTO definitely shows promise as a general topical agent, they don't highlight recent human clinical trial data demonstrating exceptional high cure rates for challenging fungal infections like, say, onychomycosis, nail fungus, when TTO is used completely on its own as a standalone therapy.
Okay.
Especially when you compare it to potent conventional antifungals available by prescription.
So the promise is there in the lab, but the recent evidence for it being an exceptional standalone cure for tough fungal issues in humans isn't strongly supported by these particular studies within this time frame.
Precisely. Older studies, cited in reviews, had kind of mixed results. Modest success rates for nail fungus when used alone. For athlete's foot, it seemed more effective symptomatically at lower concentrations, maybe needing 25–50% concentration for higher cure rates. It might have a role as an adjunctive agent and add-on therapy. An older study combined it with butenofine, for example.
Okay, so maybe helpful alongside other things, but not the standalone superstar cure the marketing sometimes suggests, based on this recent evidence.
Based on the recent human trial evidence for exceptional cure rates, yes.
Got it. What about that May 2024 study on TTO mouthwash? I saw that mentioned.
Ah, yes, that's an interesting one. That study showed TTO mouthwash was effective against bacterial plaque gingivitis, comparable or even superior to CHX, again, with fewer side effects. So, good news for oral hygiene.
But that's bacteria in the mouth, right?
Mm-hmm.
It doesn't really speak to its fungal efficacy elsewhere on the body based on this timeframes research.
Exactly. Different target, different condition. So TTO, promising lab data, useful as a general topical antiseptic, good for bacterial gingivitis. But the recent exceptional human trial data for standalone fungal relief isn't strongly highlighted here.
Understood. What about myrrh? Commiphora myrrh, another ancient remedy, smells amazing.
Myrrh has been used traditionally for healing for literally centuries. A key recent study, a 2021 randomized controlled trial on post-tooth extraction healing, is particularly interesting.
Like after getting wisdom teeth out, that kind of thing.
Exactly that scenario. That study found that using a Myrrh mouthwash led to significantly better healing outcomes after just 1 week compared to a simple saline rinse. We're talking less edema, so less swelling, less tenderness. The sock dit size reduced more quickly, fewer inflammatory signs overall.
For such a common procedure, that sounds like a big practical benefit. Why is that exceptional then?
Well, because it's modern, rigorous clinical evidence validating a traditional use for a very common clinical issue. It shows a tangible, measurable improvement in the healing process and reduces discomfort, offering a natural way to support recovery. It's validation.
Makes sense. And berberine, I see it mentioned quite a bit, often for metabolic health, but here for antifungal potential.
Berberine shows really strong promise in lab studies, in vitro, against drug-resistant fungal strains like Candida albicans and Cryptococcus neoformans. Older research even suggested it could work synergistically, meaning it boosts the effect of conventional antifungals like fluconazole.
So lab results are exciting for fighting resistant fungi.
They definitely are. But, and this is an important distinction based on the sources provided, the documents we reviewed do not contain recent human clinical trial results from this May 2020 to May 2025 period showing berberine delivering exceptional cure rates or clear superiority over standard treatments for serious, systemic, or highly resistant fungal infections in actual patients.
Okay.
The leap from that lab promise to proven exceptional human efficacy for these really challenging infections isn't documented documented in this specific set of recent evidence. Still needs that clinical validation for exceptional claims.
Okay, understanding that distinction between lab promise and proven human outcome is crucial. What about Propolis? Bee glue, right?
That's the one. Propolis is pretty well known for its oral health benefits, fighting bacteria like Streptococcus mutans that cause cavities, reducing plaque, helping with gum inflammation. A recent review noted its potential in endodontics, so root canal treatment, but called for more definitive evidence to show a clear advantage over other materials used there.
So, good for the mouth.
Yeah.
And for treating more widespread systemic infections.
Similar to berberine, these specific sources do not highlight recent human trials from 2020 to 2025, demonstrating propolis provides exceptional relief for severe systemic bacterial or fungal infections beyond its localized benefits in the mouth. It's valuable for oral health, yes, but not presented as an exceptional treatment for major systemic infections based on this timeframe's research.
Right. So, useful in its niche, but not positioned as a broad-spectrum cure-all here. Okay, let's move beyond infections now and look at other conditions where natural products are showing remarkable results.
Yeah.
Often it's the chronic, difficult-to-treat conditions where new options are most welcome.
Absolutely. And this is where traditional Chinese medicine, or TCM, specifically for chronic obstructive pulmonary disease, COPD, really stands out based on the recent sources. COPD, as you know, is a progressive lung disease, and conventional treatments have pretty limited ability to actually slow its decline over time.
It mostly manages symptoms, right?
Mhm.
So there was a significant study using TCM for COPD.
Yes, a very large, multi-center, randomized, double-blind, placebo-controlled trial. Really, the gold standard design involving over 500 patients with mild to moderate stable COPD. They were studied over 2 years, with results coming out around 2024-2025. They used formulations like Bufei Yishen granules and related combinations.
That level of rigor is really impressive for traditional medicine research. What did they find? What were the outcomes?
Well, the TCM group saw quite a few benefits compared to the placebo group. Significantly fewer acute exacerbations, those flare-ups that often land people in hospital. They also had improved symptoms, better exercise capacity measured by the 6-minute walking distance, so how far they could walk.
All really important quality of life improvements for someone with COPD.
Absolutely. But here's where it gets really interesting and, well, exceptional based on the source's definition. They also saw a significant improvement in lung function, measured by FEV1, which is how much air you can force out in 1 second. And crucially, they observed a slower annual rate at which their FEV1 declined over that 2-year period.
Wait, hang on. It potentially slowed the progression of the disease itself, not just managed symptoms.
That's the major implication, yes. Slowing FEV1 decline is something conventional therapies really struggle to achieve consistently. It's considered a key goal in COPD management. So this finding suggests a potential disease-modifying effect, which is extremely rare for any COPD intervention, natural or pharmaceutical, and represents a truly exceptional outcome from this large, high-quality trial.
Wow. Okay, that is exceptional. A potential game changer if further research confirms and expands on it.
Yeah.
And there was another TCM study for COPD mentioned, showing superiority.
Yes, an April 2025 randomized controlled trial looked at a specific TCM combination, Bufei Yishen and Coton Tonglua cream, or BYQTC, used alongside standard care. It showed this combination was superior to standard care alone in about 96 patients.
Superior meaning better across the board.
Pretty much, yes. It led to significantly greater improvement in lung function, FEV 1%, the 6-minute walk distance, better symptom scores using standard scales like MMRC and CK, reduced levels of inflammatory markers like IL-8 and MMP9 in the body, and importantly, fewer exacerbations and rehospitalizations during the 6-month follow-up period.
Okay, so demonstrating clear superiority over standard care across such a broad range of critical outcomes, lung function, symptoms, inflammation, future risk, that's undeniably exceptional.
It really is. It highlights the potential impact when these complex traditional approaches are studied rigorously.
These findings really underscore that potential. Okay, shifting gears completely now, mental health. Saffron, Crocus sativus, for depression.
Yes, major depressive disorder, or MDD, is incredibly prevalent, and finding effective and well-tolerated treatments is obviously essential. Saffroners have studied quite a bit here, and a recent systematic review, which was anticipated for 2025 but appeared online in August 2024, pooled data from 23 randomized controlled trials. It found, quote, encouraging outcomes.
Encouraging is good, but what makes the saffron findings exceptional, according to this review?
The key takeaway from the review was that saffron demonstrated efficacy that was, quote, equally efficacious as well-known antidepressants like imipramine and fluoxetine, for mild to severe depression.
Whoa, hold on. As effective as some standard first-line pharmaceutical options, that's really noteworthy.
It is, and just as important, the review noted, quote, no discernible variations in the reported adverse effects when comparing saffron to these standard drugs.
So potentially comparable effectiveness with a similar, or depending on the specific conventional drug you compare it to, perhaps even a more favorable side effect profile. Is that the implication?
That's the potential impact, yes. For you or anyone looking for options for depression, having an herbal treatment that's been validated by multiple studies as being similarly effective to standard drugs, maybe with a different side effect profile that might suit you better, well, that offers a really valuable alternative or perhaps a complementary approach. It definitely meets a niche for more treatment choices.
That makes a lot of sense. It broadens the toolbox for patients and practitioners.
Exactly. Though, as always with natural products, the review did call for more research on things like standardizing saffron extracts, making sure you get a consistent product, and understanding long-term effects and mechanisms better.
Understandable. Okay, let's zoom in now on a very common issue many of us might face.
Yeah.
Post-surgical dental pain and inflammation. After getting a tooth pulled or something similar. Chamomile gel was mentioned.
Yes, Matricaria recudita, or chamomile, traditionally used for soothing inflammation. And there's a really high-quality, rigorous trial reported around 2023-2024 that looked specifically at using chamomile gel after impacted third molar extractions wisdom teeth. It was even triple-blind.
Triple-blind. So the patient, the dentist administering it, and the person evaluating the outcome didn't know who got the active gel versus the placebo.
Correct. That's a very high standard for reducing bias, and the results were quite striking.
What did they find?
Compared to the placebo gel, the group using the chamomile gel had significantly improved gingival healing, so the gums healed better. They reported much lower pain scores on a standard visual scale, and, maybe most impressively, they used substantially less analgesic medication, fewer painkillers overall. Their total score for postoperative symptom severity was also dramatically lower.
Less pain, faster healing, and less reliance on painkillers, all from just a topical gel applied in the mouth.
That's precisely why it qualifies as exceptional here. It's a localized, non-systemic treatment for a very common and often quite painful procedure. By reducing the need for systemic pain medications like NSAIDs or even opioids, you minimize their potential side effects. Plus, it shows that dual action. It relieves pain and inflammation while also promoting better healing. That combined local effect is a major plus for recovery.
Yeah. Reducing the need for prescription painkillers, especially opioids, is a huge win in many cases. While we're on pain, what about magnesium? It's often mentioned for pain relief, muscle cramps.
Magnesium does have plausible mechanisms for pain relief, like blocking NMDA receptors, which are involved in pain signaling pathways. For acute postoperative dental pain, the recent picture from our 2022 and 25 sources is maybe a little mixed. An older study, cited in 2020 by Durkovic et al., suggested oral magnesium citrate could significantly reduce pain and trismus, which is jaw stiffness after surgery, acting as a primary analgesic.
That sounds very promising if a simple mineral could potentially replace or reduce the need for prescription painkillers.
It would be, absolutely, if consistently replicated with strong effect. However, a more recent study anticipated for 2025 by Nimkelrat et al. Looked at oral magnesium as an adjunct, so an add-on, to ibuprofen for wisdom tooth pain. They found a more modest benefit, it reduced resting pain at 24 hours, but didn't significantly impact overall pain or pain with movement as much. So its exact role and magnitude of effect for acute pain might still be getting clarified in these very recent studies.
Okay, so some signal, but maybe not a slam dunk replacement yet, based on this evidence. What about chronic pain, like persistent dental nerve pain or something severe like trigeminal neuralgia, that awful facial pain condition?
Magnesium's mechanism is definitely relevant there, theoretically. And older research, mostly using IV magnesium, has shown benefits for severe intractable cases like trigeminal neuralgia. A 2013 case series reported sound pain relief.
Beer. Okay. But what about taking it orally for those chronic conditions?
Well, based specifically on the sources from this 2020-2025 timeframe that we're focusing on, there is a lack of recent human trial evidence confirming exceptional efficacy of oral magnesium specifically for chronic dental nerve pain or trigeminal neuralgia. In fact, a September 2024 review looking at treatments for post-traumatic trigeminal neuralgia didn't even mention magnesium as an intervention.
Okay, so potential there based on mechanism and older IV data for really severe conditions, but the recent evidence for exceptional relief from oral magnesium for those specific chronic nerve pains isn't strongly present in these documents. Got it. What about vitamin D? We hear so much about vitamin D for everything.
Vitamin D is quite interesting because it shows potential benefits in both oral health, specifically inflammation, and also potentially in pain management. There's a pretty consistent link researchers have found between low vitamin D levels, vitamin D deficiency or VDD, and an increased risk and severity of gingivitis and periodontitis, gum disease.
So not having enough vitamin D means your gums might be in worse shape.
That seems to be the connection, yes. Vitamin D plays important roles in immune modulation, fighting inflammation, and maintaining bone integrity, all critical for healthy gums and the structures supporting your teeth. Older research, like a 2013 RCT, showed supplementation had a dose-dependent anti-inflammatory effect on gingivitis, and a 2024 systematic review protocol specifically recognizes this link as important to study further.
Why is simply connecting vitamin D deficiency to gum disease and suggesting supplementation considered exceptional? Isn't that just good health advice?
Well, it's exceptional in its potential impact and simplicity. Gum disease is incredibly common, affecting a huge portion of the population. If low vitamin D levels contribute significantly to its risk or severity, then ensuring vitamin D sufficiency becomes a relatively simple, low-cost public health measure and an important adjunctive strategy for preventing and managing this widespread condition. It's about the potential for broad foundational impact from a simple intervention.
Okay, I see. Widespread problem, simple potential contributor. And you mentioned a link between vitamin D and pain, too, specifically burning mouth syndrome.
Yes, burning mouth syndrome, or BMS, is a chronic, often really challenging neuropathic condition where people feel a burning sensation in their mouth without any obvious dental or medical cause. A study anticipated for 2025 found a significant association. Patients with lower serum vitamin D levels reported higher pain intensity and also had a lower quality of life. And they also found an inverse link between vitamin D levels and a marker of systemic inflammation, HSCRP, in these BMS patients. So low in D, potentially more inflammation, more pain.
So low vitamin D, more burning pain, possibly more inflammation in these BMS patients.
That's the pattern suggested by the study and supported by others. And a broader 2024 systematic review looking at vitamin D for neuropathic pain generally also found an overall benefit of vitamin D supplementation in reducing pain across various conditions, although more high-quality trials are needed.
That's compelling. For a difficult-to-treat condition like BMS, optimizing something as relatively simple as vitamin D status shows real potential for alleviating pain and, importantly, links inflammation to the pain experience in this specific context.
Exactly. It points to vitamin D having a potential dual benefit in the oral cavity, helping manage the inflammation related to gum disease and potentially offering relief for certain chronic oral pains like BMS where inflammation might play a role.
Really interesting connections there. Finally, given the time frame we're looking at, May 2020 to May 2025, it's pretty much impossible to ignore the COVID-19 pandemic. Were there any insights from these sources into natural interventions for viral infections, specifically in that context?
Yes, absolutely. The sources did highlight some specific traditional Chinese medicine interventions that were studied for mild or symptomatic COVID-19 patients, typically used as adjunctive therapy, meaning alongside standard medical care.
Okay, used as an add-on, how did they perform?
Well, a 2023 study on something called granules, used alongside standard care, found that patients receiving the granules had a significantly higher rate of achieving a negative PCR test clearing the virus, and also had a shorter median time to reach that negative test result compared to those getting standard care plus a placebo.
So potentially speeding up recovery and viral clearance.
That was the finding, yes. Similarly, a 2021 study looked at reduning injection, another TCM preparation, also used adjunctively. It found patients receiving it had a significantly shorter median time to viral clearance compared to standard care alone.
Okay. Why are these findings considered exceptional in this context?
Because they demonstrated significant adjunctive benefits specifically, accelerating viral clearance for an acute viral infection during a major global public health crisis. They showcase the potential for evidence-based traditional or herbal medicine to effectively complement standard medical approaches, which was incredibly valuable when treatment options were evolving rapidly during the pandemic. It showed a role beyond just symptom management.
Okay, wow, that was a really comprehensive run-through of some specific findings. Maybe let's take a step back now and think about what this all means in the bigger picture. Yeah, it really reinforces that definition of exceptional we started with, doesn't it?
Yeah.
It's clearly not just about statistical significance in these sources. It's about addressing those unmet needs, offering genuinely new angles, or providing real-world advantages like better safety or patient preference compared to what's currently available.
Precisely. And what really stands out to me looking across these studies is the rising quality of the evidence in natural product research. We're seeing large, well-designed, rigorous studies, multi-centered, double-blind, placebo-controlled RCTs like for Ibrexafungerp and the COPD TCM trials, even triple-blind designs like the chamomile study. Plus, systematic reviews are carefully synthesizing the evidence for things like saffron and the herbal mouthwashes. This isn't just anecdote anymore, it's increasingly solid science.
And of course, natural products aren't without their challenges, are they? It's not always straightforward.
Not at all. There are inherent challenges. Ensuring consistency and standardization of complex plant extracts can be really tricky. Batch-to-batch variability is a known issue. Blinding studies can be difficult, especially if the treatment has a distinct taste or smell. And like with any therapy, confirming long-term safety, especially potential interactions with other medications, takes time and dedicated research which isn't always there yet.
Right, those are important caveats. But despite those challenges, the potential impact of the findings we've discussed today seems huge. A new antifungal tackling resistance, a potential way to actually slow progressive lung disease, a credible herbal alternative for depression, finding ways for better recovery from common surgeries with fewer painkillers, even simple interventions like optimizing vitamin D for widespread oral issues and pain. These findings really address real, everyday health concerns for many people.
They really do. And what's also fascinating is that many of these studies represent modern science, validating traditional knowledge that's been around for centuries, sometimes millennia. Seeing rigorous trials confirm the benefits of things like myrrh, chamomile, or specific complex TCM formulations is a powerful intersection of old wisdom and new scientific methods. That synergy itself is a potent pathway for discovery.
Definitely. So, based on these sources, where do we still need more research? What are the key gaps?
Oh, there are definitely still gaps highlighted or implied. We clearly need more large, long-term, randomized controlled trials for many of these promising interventions to confirm efficacy and safety over time. We need a deeper understanding of the mechanisms of action, especially for complex mixtures like in TCM. How do all those components work together? Head-to-head comparison trials would be incredibly valuable.
You mean comparing different natural products directly? Or natural versus conventional?
Both, really. Comparing, say, different herbal mouthwashes or comparing saffron directly against a wider range of antidepressants beyond just the two mentioned. And as these natural options become more commonly used alongside conventional medicine, robust data on potential herb-drug interactions is absolutely critical for patient safety. That's a major area needing more focus.
That makes sense. And that spectrum of exceptional you mentioned earlier, it's worth reiterating that.
Yes, I think it is, because exceptional here isn't one single thing. It ranges from a molecule originally discovered in nature that goes through the full pharmaceutical development path, like Ibrexafungerp becoming a regulated prescription drug, all the way to a complex traditional formula, like those used in TCM for COPD, showing potential disease-modifying effects when validated by top-tier clinical trials. And it absolutely includes demonstrating that a natural option is as effective as a standard treatment, but provides a significant advantage in other crucial ways, like better tolerability, fewer side effects, or better patient preference. We saw that potential with saffron for depression compared to some SSRIs, and with some herbal mouthwashes versus CHX. Being comparable in efficacy, but better in terms of side effects or usability can be truly exceptional from a patient's perspective.
That's a great point. Improving the patient experience and reducing the burden of side effects is a critical part of what makes any treatment successful in the real world.
Absolutely. And the bottom line is, the fact that the standards of evidence are clearly rising in this field means these kinds of exceptional findings are becoming increasingly credible and trustworthy. This makes them vital information for you, the listener, to be aware of when making informed decisions about your health.
Wow, that was a genuinely deep dive into some truly exceptional findings in natural medicine from just the last few years. It's quite remarkable when you lay it all out.
It really is exciting to see how rigorous science is confirming and sometimes expanding our understanding of the therapeutic possibilities that come from nature.
Yeah, from tackling antibiotic resistance with novel antifungals derived right from fungi themselves, to potentially finding ways to slow the progression of devastating chronic lung disease with complex traditional herbal formulas, to offering safer, perhaps better tolerated options for common ailments like depression, gum disease, and post-surgical pain, the research is showing remarkable potential to impact your health and well-being in tangible ways.
And these studies really highlight that nature continues to be an incredibly rich source of potential medicines. When we combine that potential with a thoughtful, evidence-based scientific approach, we can uncover and hopefully integrate these possibilities into healthcare more effectively.
So here's maybe a final thought to leave you with today. As we continue to face really complex health challenges globally, how might this growing body of high-quality evidence on natural products start to reshape our collective understanding of what constitutes effective medicine? And perhaps more personally, what new possibilities might open up for your own health and wellness journey when traditional wisdom is truly illuminated by the brightest light of modern scientific rigor?